Listen to what happened in France right before. Imagine you had a product that would have been great for just a scenario like this, but suddenly it's made almost impossible to get to. Watch this.
Hydroxychloroquine in France was, you can buy it without any prescription in any pharmacy. You can buy them like sweets or gums or fruit. It was
right. You can buy it like candy.
Before the pandemic arrived in France, I think it was in February, the Minister of Health at that time, Agnès Buzyn, passed a text to put hydroxychloroquine, to put it with a mandatory prescription just a few weeks before it arrived. And after that, when the pandemic arrived in France, I treated many patients in my hospital, and in Marseille and in my hospital, we had the lowest rates of death in all France.
If you remember hydroxychloroquine, they knew what drug was going to be used, and suddenly, randomly, a couple of weeks before the next coronavirus comes into France, they take a drug that is used for everything from river blindness to lupus. Everyone's taking it. It's literally over the counter. People pop this stuff like candy worldwide. Suddenly they move it to prescription. And lo and behold, the most important moment you would ever need it comes a couple of weeks later. But now you're going to need a prescription, and we're blocking it from you. And then everybody starts getting the vaccines, and they're getting injured like we've seen all over the world. So speaking of words, there's been a lot of words around the COVID pandemic. The most frequent ones are, we should forget it, we should put it in our rearview mirror. Obviously, it's not in our rearview mirror. It's frontline news right now with what's going on with Anthony Fouché. And I have been touring the world. I'd sort of thought I understood COVID almost completely until I started meeting all of these experts in other countries. You watched our breakdown of my interviews with Italy, where I was finally, I think, forced to face enough evidence to say clearly this was some form of a pandemic. There were plans ahead of time that cannot explain the way Italy, was in lockstep. How immediately they were told not to use hydroxychloroquine and other things. How immediately they said put them on ventilators and remdesivir. How immediately they said we're going to pay you more for COVID. Well, now we're in France, and now I'm talking to the experts there. Remember, I am not just talking to some doctor. These literally, some of them are the best of the best. In fact, one of the highest ranked vaccine experts I have ever spoken to is coming up. But first, let me start with the man that made this tour possible. It also was the leading voice in building the medical freedom resistance. He was a doctor on the front lines, saving people's lives until they tried to destroy everything he was doing. This is Louis Fouché.
Dr. Louis Fouché, that's my name. And the first thing that we have to say when we go in any media is that I don't have any conflict of interest with any pharmaceutical, vaccine industry, anything that earns money in any way. Actually, I lost nearly everything during this period. And I'm specialized in intensive care and critical care medicine. You could compare me to Pierre Curie, that maybe the audience would know. Meaning that most of our patients have critical condition, and just like we are plumbers of the body, breathing, circulating, neurologic function, renal and metabolic function, hepatic and digestive function, and hematologic function. I used to work in the public hospital of Marseille, and it's a big hospital. It's a university hospital, and so second most important institution in France. It was in the very heart of COVID. We were told it's going to be awful. And we will be in what we call mass casualties plan. You will be overwhelmed with the patient. And so we were just like, oh, wow, what's going to happen? We were afraid. And from that moment on, we received webinars, information, protocols coming from Paris and coming from the WHO and coming from China, telling you should do that. You should do remdesivir. You should intubate very early. You should not use this and this. Everything that we knew were wrong. Remdesivir was bullshit. We knew it from before, from Ebola and from before. Intubate early, we know it's not good, because when you intubate and put mechanical ventilation, that means you put sedation. And if you put sedation, that means the patient is not moving anymore. If it is not moving anymore, he's losing all these muscles. It makes some erosion of the skin. It will you will need to feed him, and it will overwhelm the nurses with a workload which is overwhelming them. And our rate of lethality for the first wave of COVID was 0%.
Wow.
The one who were respecting the protocols, they had between 30 to 40% of lethality, which is considerable.
Was it hard to treat?
No, it was nearly one of the easiest disease that we have. As I told you, most of the patient we must intubate with noradrenaline, put a renal replacement.
I'm used to doing a bunch of you didn't have to do any of those things.
Just oxygen and wait and watch. And it's hard for the patient for like 2 or 3 days. It will be like that, and that's all right. But you know, one of the most difficult things for the patient was to be insulated, because they had like a Ebola, and their disease was so hard. So psychologically, seeing all the healthcare provider with big mask and all the equipment, it was just like, oh wow, what's happening to me? And there was so much stress,
like
so
you're
much
dying
stress for the patient,
disease.
you know.
So you're having a 100% success rate in your ward. You are doing things differently than another local hospital. They're having a 30 or 40% lethality. Do you get celebrated? Did they celebrate, and did WHO send specialists and say, brilliant job, what are you doing? You're doing better than everyone else.
Yeah, for sure. I received the medal. No. When we told our chief in Paris and things like that we could do otherwise, they said, you're a murderer. You're a murderer. You shouldn't do that. But we had 0% of lethality. That's just crazy. And the media were telling, it's so harsh. We're all going to die. This is so severe, you know, that we have to transfer by TGV, by the train. We have to transfer the patient to another one because we have jammed all the wards. But the intensive care units in France, they are already naturally jammed, because we have an administrative compulsory thing. We must be filled more than 90%. Otherwise, we lose our funding. They say, oh, you don't have your bed, you have bed empty. Your nurses are not useful. We're going to put away your funding, and you're going to lose. So we're already, all the time, we try and stay packed and full. And this organization make that we were never jammed, and everything was going all right. But, you know, in the end, we had a report in France about the activity of the hospital named ATIH, l'Agence Technique pour l'Information Hospitalière, the Technical Agency for Hospital Information. And they said that during 2020, there was only 2% of the hospitalization that concerned the COVID. And in the intensive care unit, there was only 5% of hospitalization that concerned the COVID. I mean, this jamming thing of the intensive care unit is just a lie. It was so strange for me that I had to cry for help, sending a message in my whole hospital saying, can we discuss of what's going on? And I received like 10 answers really harsh, saying that I was a conspirationist, that I shouldn't say that. But I received 100 other answers of people privately, not publicly with everybody in the loop. And privately they said, you're right. Myself, I'm asking the question, what's happening? Thank you for opening the subject.
They wouldn't do it in a group, but I'll put it. I mean, it's amazing how few doctors felt empowered. When you look at how this thing was planned and put together, they knew what doctors were made of. They knew all they had to do was attack the Louis Fouché, shut down the Louis Fouchés of the world. And this is what I've discovered. Our best and brightest were the ones that were taken out during COVID. We are left with the drones now of medicine around the world. Those that will just do what they're told. Those that will just say to Louis Fouché on the side, thank you so much for what you're doing. I really appreciate it. I can't speak up. I'm not going to support you, but I know you're telling the truth. And boy, I hope you win on that all by yourself. Those heroes that stood on their own are still the most amazing. And maybe the only hope we have as we look to the future for a pandemic they keep saying is not if, but when. I had the opportunity to sit down with Dr. Christian Perronne, who is the highest ranking official. This man was responsible for the vaccine program in France for, I think, 15 years, responsible for a vaccine program all over the world, in fact. So what did he know? What did he recognize? And what happened? How did this guy suddenly get flagged in the middle of COVID? I mean, wasn't he on board? Wasn't he in those original meetings? Was he not at event 201? Why wasn't he there? Watch this.
I was chairman of one of the major public health institutions to counsel the governments about public health issues, epidemics, vaccination. And I was the president of the official vaccination committee to counsel and manage the vaccination policy in France.
I think it's safe to say that you're the highest ranking vaccine official that I have ever interviewed.
Yes.
What was it that first happened with COVID that just stood out?
So when the COVID crisis arrived, immediately I saw that it was a great manipulation. And I was very popular in the mainstream media during years. I was sometimes sent by the Ministry of Health, and I was many times at the prime time on the main TVs to speak about vaccination, infectious disease crisis, and so on. So I had many friends among the journalists, and at the beginning of the COVID crisis, I was invited several times a week from March 2020 to the end of August. Every week I was on the TVs. Yeah. But Macron and his team and the Minister of Health were very upset because I was...
What were you saying?
I was demolishing all their narrative every week.
It wasn't...
I spoke about the mask, about the hydroxychloroquine, which was censored, about the PCR tests, which were designed to diagnose false cases in people in perfect condition, and after that on vaccines and so on. So I was
specifically, did you believe COVID was truly an epidemic? Was it dangerous to everybody?
No, it was not so dangerous. After August 2020, the government was so upset that they made a press release saying to all the media, to all the TVs, now you are not allowed anymore to invite Professor Perronne because he's a charlatan. And
they published it to the world. No one is allowed to interview you any longer.
And a few TVs continued to invite me, but at the end they had huge fines.
They fined them.
They fined them. The director general of this group, of the hospitals, I knew him very well because sometimes we had some friendly relationship before. One day at 7 o'clock in the morning, I had to come to his office in Paris, and he told me, he gave me a letter where I was a charlatan, that I was responsible for death threat for young colleagues because he invented a whole story, and that I was fired from my position of head of my department. I was head of the department for, I don't remember exactly, maybe 25 years. And after that, the National Order of Physicians, which control all the physicians in France, trialed me at the disciplinary commission one day. The National Order wanted me to be fired. They would like to withdraw my license to practice.
Wow, it's quite a judgment.
What was amazing, when I went outside from the Order of Physicians, the verdict was not yet available. It was a few weeks later. There were 3,000 people in the street to support me. For me, it was a fantastic warm for my heart, because of this popular support was fantastic. But it was a difficult period for me.
Do you believe there's an agenda from the beginning behind it?
And I remember there was a group of German lawyers who sent me a list of all the citations of the future coronavirus pandemic. And even Bill Gates in the event 201 in Baltimore, he made a special repetitions just a few weeks before the start of the pandemic. And if you look at what was said, it was not about how to manage the patients, the death. They didn't care about that. Their only speech was, when the pandemic will occur, there will be some misinformation, fake news among journalists, the population, how to control this fake news. It was their only.
So communication was all they cared
And
about.
after that, I think that what they want always maintain the populations in fear. If you remember the Nuremberg trial for the Nazi officials,
Yes.
one guy asked to, I think it was Goering, the Nazi general, how did you do to control like that? He said, oh, it's very easy to control a population. The only thing you have to do is to threaten them. Every day on the TV, they said you are all at risk of death tomorrow, and people were really frightened, and they asked for the vaccination to save them. It was terrible.
I mean, he's right. All you have to have is fear, and people will do whatever you want, and fear, doctors will do what they want, obviously. I mean, this guy, look how he describes himself, where he was at. He's running the vaccine program. He's the guy you call to be on television. He's almost like their Anthony Fauci, but God forbid you reasonably say, wait, something doesn't make sense here. This isn't adding up. Your numbers are wrong. This is wrong. And suddenly now, like, you're the bad guy. It's amazing that they were able to achieve this all around the world. I've got some more incredible insights that Perronne gives us. But first, I want to talk about outside of the science. What happens in academia? You know, we know that the doctors are controlling the people, but what about the universities? This is a mathematician that was working in a university, and like many of the others we've spoken to, could crunch data. That's what he does. Statistics, you name it, this is his talent. What happens to a guy who lives in a world of math, where there is no guessing, there is only fact? This is Vincent Pavan.
My name is Vincent Pavan. I am a mathematician. I work at a university, and one day in 2020, I refused to have a face mask in front of my student. And then I was suspended for 3 years by my university. At that time, I became an activist in order to defend the freedom, of course, and to fight against false science, especially in the fields of mathematics and prediction. Because since the beginning, all the decisions during COVID were made upon modeling, especially, for instance, by Neil Ferguson in Imperial College. All these models, all these predictions, they are completely false.
Were you shocked that you could not make a reasonable argument with the university?
Yes, I was really shocked, because normally university, you know, it is the land of freedom, of, you know, controversy, of being critical of yourself and of the other. And it is a space of discussion. It was not possible for me to imagine such a situation where rational arguments could not be heard by my colleagues. So, especially in the domain of mathematics, because we have a very high level of proof, and I, wrote about 100 pages of proof and mathematical computation to tell my colleagues, okay, look at this, look at it, I can be wrong. Or if I am wrong, please tell me. Please look at what I have written. But nobody did it.
How do you explain that? Because now you're talking about a university. This isn't even the healthcare system. Why is the head of your university? Who's talking to them? Who's telling them, fire anyone that asks a question?
In France, face masks were mandatory at school, at university, even for very small children. And, normally at university, you are free to do your teaching the way you want. The only condition is tolerance and objectivity. So my point of view was objectivity is that face masks are useless. So tolerance is not to make them mandatory. That's very simple. And it was for me an argument so that teachers in elementary school or secondary school could use in order, to prevent their pupils to have masks which were really, harmful to the children. And the state, probably the administration and the presidents, didn't want me to have these arguments in the university, so that No teacher at elementary school could use it.
We can't have the disease of critical thinking spreading throughout this university. That will be a problem.
Yeah, very big problem. And when I was suspended, I began writing books and thinking about politics and philosophical politics. And my question was how totalitarian system use science to rule people. For me, it was very strange because science is not meant for politics. Politics is a free debate. And science, when you have the truth of science, nothing can be debated. So if you tell that science is the basis for politics, then you cannot decide for anything. And this is,
Interesting thought. I hadn't thought about that. Because if you think of science like math, you can't fake math.
Yeah.
Math has one result. There's no opinion about it. Politics, there's no proof that one way of politics is better than another, just an opinion. So it's interesting. Science, math should never get involved with something that can't be decided.
Yeah, exactly. If life is put in mathematics, you cannot decide to anything. And this is the reason why, the government in France told us you can doubt about everything except figures.
Right.
So if everything is in figures, you have nothing to say. And this is the danger of mathematics, because if everything is mathematics, so people cannot decide, as you told.
They have no free will, really.
Exactly.
Interesting.
It's a very interesting point. Of course, obviously, he saw the same red flag we did in the Neil Ferguson Imperial College modeling, which said that millions and millions of people were going to die. This guy, obviously, when we talk about Neil Ferguson, is the definition of failing forward. He was wrong. He's had cattle slaughtered all over England for no reason. Oops, was wrong about bird flus and hoof and mouth disease. This guy is Bill Gates's destruction master. And here you had a mathematician saying, none of this adds up. This is what I do for a living. These numbers are wrong. We're not allowed to recalculate them. What do you mean we're not allowed to recalculate them? All the way down to the university level. Heads of universities are being told, stop the math, stop the science. None of that is allowed. And they went along with it. But I thought Vincent made a very, very interesting point that I was reflecting on some of the things that happened last week when he was talking about how he believes what was dangerous is that when math and politics comes together, it made me think about why our country is supposed, in the United States of America, we're supposed to have separation of church and state. Part of it's because if your minister, your religious leader says, God told me to tell you to vote Democrat, or God told you to vote for so-and-so, how do you refute that? If God is speaking through, the person I'm listening to, then I can't argue that. It's an unfair advantage or space where it's totally subjective. Every politician, we have the right to choose. There's no perfect solution there. Odds are we probably know they're all lying a little bit, but he talks about it with math as being the same thing, that if politics attaches itself and says, this is the math, this is the science. Math and science aren't supposed to be debatable. They're supposed to be facts. And when they state this is the fact, you no longer can vote. You are no longer, now you have an authoritarian idea set by science because it's supposed to be irrefutable. There's no argument here. And it made me think, if you've been watching the show when I was questioning, why are the Democrats so in lockstep with Fauci? What is it they're standing behind? They want to keep gain of function going. They want to be able to lock us down again. They don't want to stop that. But it made me think maybe it's just this. Because they keep saying, right, the Democrats like to say we're the party of science. And by doing that, what they're saying is we're the party with irrefutable evidence. We can't be questioned. You're not allowed to question us, which is perfect for an authoritarian outlook, which is you can't question us because we have the science. Unfortunately for them, the science just pled the fifth on their behalf, but you see how they want to use it. You're not allowed to question me. The experts have spoken. We do not look at the doctrine. You must believe because there is no question here. Super fascinating, I thought, talking about math and politics together. Now, if there was one real smoking gun in this argument that this was all planned, you know, on top of the things I found in Italy or in even Japan. But listen to what happened in France right before. Imagine you had a product that would have been great for just a scenario like this, but suddenly it's made almost impossible to get to. Watch this.
Hydroxychloroquine in France was, you can buy it without any prescription in any pharmacy. You can buy them like sweets or gums for the throat. It was
Right. You can buy it like candy.
yes, over the counter without any condition. Complications were very rare. And, millions of people took chloroquine or hydroxychloroquine in France, in the former French colonies, in Africa, Asia, during decades without any problem. And before the pandemic arrived in France, I think it was in February, the Minister of Health at that time, Agnès Buzyn, passed a text to put hydroxychloroquine, to put it with a mandatory prescription just a few weeks before it arrived.
No way. Weeks before there's any COVID understanding, the Minister of Health in France decides to pass a law that hydroxychloroquine, which is being sold like candy, you can just get it without a prescription. Now it must require a prescription just before.
And after that, when the pandemic arrived in France, Didier Raoult treated many patients. I followed him. I treated many patients in my hospital. And in Marseille and in my hospital, we had the lowest rates of death in all France. And we published our experience. It was in a preprint. At that time, all my assistants, the team in my hospital, were fully with me, and they were.
Must have been excited, like you're like, we've got an answer.
But when the preprint was published on internet, it was terrible. The leaders of the hospital groups called them, my colleagues, and they said, if you continue to follow your stupid and foolish boss, who is now a charlatan, your career will be finished, you know.
But I mean, they're working for you. They see the success. No one stood up for you. No one said you're wrong.
They were not courageous, and they withdrew the article from the preprint site. I was upset about that, but I couldn't fight with all my colleagues within my department. It was so difficult. I was alone, and when the false paper in the Lancet from Mera,
You're talking about the surgisphere.
yes, saying that it was published just the time of the first wave, saying that there were a huge number of people in the world died because of hydroxychloroquine. The day the Lancet was published, our Minister of Health, Olivier Véran, has forbidden the prescription of hydroxychloroquine for liberal physicians. I wrote 3 books about the COVID crisis. The first one, Is there any mistake that they didn't commit, was the title of my book, published in June 2020.
Is there any mistake they didn't commit? Like meaning everything they did was wrong?
It was a bestseller in France. It was a fantastic success. They were very upset.
I want to revisit some of what he just covered there because we may have forgotten it. I know I live and breathe this stuff. I'm so fascinated by these interviews because the pieces, these little tiny pieces are all starting to fit together. But if you remember hydroxychloroquine, the President of the United States, Donald Trump, says, look, it sounds like we have a product that might work. I want the FDA to make it readily available. And then Henry Ford Health, run by what? Dr. Marcus Zervos, the center of our film, An Inconvenient Study. This was his study. Hydroxychloroquine lowers COVID-19 death rate. Henry Ford's study found that there was a 50% reduction in deaths amongst those that were treated with hydroxychloroquine versus those that did not receive it. That had to be undone. As we've discussed this so much, remember, Tony Fouché, the world needed this vaccine rushed onto the market. They couldn't get the emergency use authorization unless there was no other product that could protect people or save people or help people. And all of a sudden, this is the part Christian Perronne brings up, the Lancet study, which was the Surgisphere study, and this changed everyone. Everyone said, oh, see, look, hydroxychloroquine is dangerous. Surgisphere, governments and WHO changed COVID-19 policy based on suspect data from a tiny U.S. company. In fact, doctors all over the world says, where'd your data come from? And listen to this. A Guardian investigation can reveal the U.S.-based company Surgisphere, whose handful of employees appear to include a science fiction writer and an adult content model. That was Surgisphere. It ended up being a complete and total fraud, but nobody corrected it. They used that study to say hydroxychloroquine is dangerous. People have died. It was pure baloney made by fiction writers and porn stars. But even in France, it affected them. That's how they shut it down. But that's all we'd covered up until this moment. Now think about this. Hydroxychloroquine. Didier Raoult. It comes from France, this idea, right? He's one of the masters of hydroxychloroquine. He's the one that says this is easy to treat. How do you know that? Because it was the drug they found during the original SARS outbreak, nearly a decade earlier. Tony Fouché did a study his name was on, saying hydroxychloroquine is not only good at treating, it's good at protecting from SARS. So they knew what drug was going to be used, and suddenly, randomly, a couple of weeks before the next coronavirus comes into France, they take a drug that is used for everything from river blindness to lupus. Everyone's taking it. It's literally over the counter. People pop this stuff like candy worldwide. Suddenly they move it to prescription. You need a prescription now. And lo and behold, the most important moment you would ever need it comes a couple of weeks later. But now you're going to need a prescription and we're blocking it from you. I mean, that timing, sure. It's correlation is not causation. But boy, oh boy, when you start putting this together all around the world, it's amazing. So we block a product that worked. We stop Louis Fouché from saving the people in his hospital. And then everybody starts getting the vaccines and they're getting injured like we've seen all over the world. Well, guess what? You need a lawyer. You need a lawyer to do something about it. And as it turns out, there's a lawyer they call the Aaron Siri of France. Watch this.
When I came here, they said, oh, you know, Diane is the Aaron Siri of France. You're an injury attorney. How did you get into vaccine injury?
In July 2021, the French government make it compulsory for people to get vaccinated. Not exactly compulsory, but we have the COVID Safe Pass. So you need to show your pass to enter a restaurant, to enter school, etc. So suddenly, in France, there were lots of vaccinated people, and the state organized places, public places, you know, to get boosted. And then I received lots of phone calls of people telling me, well, my son lost his sight 4 years after vaccination. My son got a heart attack after vaccination. And so usually we have 2 or 3 phone calls by month, and it's enough. But suddenly we had so many phone calls that even with me, it broke my heart. And we're saying something is happening. From my perspective, I'm no doctor, I'm just a lawyer, and I see that something is coming. And then when I started to take these cases, the problem was that usually I could make a trial against the vaccine manufacturer, at least in Europe, because we have regulation for that are superior to our national law. There is an EU provision saying that the manufacturer is liable for his product in any case. And so I was surprised when suddenly the state said to us, oh no, there is a contract between the European Union, Pfizer and other manufacturers and the national state like French, Germany, etc. And this contract that nobody has seen at the beginning has clauses and provision which says that Pfizer and others are not liable. It's totally opposite to what was in our law before the COVID. And I said, okay, but if I'm asking the state to compensate any injury, well, first of all, the state gives less money than, of course, Pfizer or other company. Usually it's 30% less for the people because if the state pays with your income, with your taxes. So can you imagine, suddenly this product is given to everyone and we are paying with our own taxes the damages that can be caused by this.
You've had an opportunity to work with Aaron Siri's law firm in some joint work. Tell me about that. How did you come together?
Well, we come together because of the help of the non-profit ICANN and the non-profit Bon Sens, which is a French non-profit I represented. We presented a case to ICANN, explaining it was about the contract that has been signed by the European Union, Pfizer, and the member state of Europe contain this provision preventing everyone to be a real victim of Pfizer vaccine in Europe, and all these contracts that are, in our opinion, unlawful, the contracts were negotiated by text message between Mrs. Ursula von der Leyen, the President of the European Union, and Mr. Bourla. And it was New York Times who talked about it and said they exchanged lots of messages, hundreds of messages between a woman and a man.
And she refuses to say what that contract is, right?
Exactly.
What did you get paid? Her husband seems to be involved on some level.
And also simple question, how come when you have public procurement, the more you buy, the less expensive it's supposed to be, not the more expensive. In the end, the more we bought in your opinion, the more expensive it was.
The more you paid.
Yes, and this text message, Mrs. von der Leyen in the European Union said that she lost them. You cannot lose. And so the citizen of the European Union should be able to see what's inside of this message. In a way, the European Union sell the rights of the European citizen to be a victim of Pfizer. They said, no, we signed this contract, you will never be able to go after Pfizer. So this is something we are keeping on fighting.
So there may almost be a loophole here in France that we don't have in America. We may be able to get a direct hit on the manufacturers through the court systems here, whereas we have a massive liability protection wall we can't get through in America.
This is exactly that. Maybe there is a loophole in Europe.
Well, if there's an Aaron Siri of France, maybe there's a Del Beatry and ICANN of France. And certainly that did prove to be the case. There's a nonprofit called Bon Sens that's run by Xavier Azalbert. And he runs a newspaper. He understands media. He started doing FOIA requests like we did. He brought in Diane Protat as an attorney to fight these cases. An amazing individual that is like a dog with a bone in France. I know the feeling. This guy and I hit it off. Take a look at this.
A statistician and an economist. Today, after being an entrepreneur, I run a newspaper, an online media called France Soir. We have developed also a legal arm, and we try to bring forth some lawsuits. For example, we brought a lawsuit against Bill Gates. For example, we also brought a lawsuit against Pfizer in order to seek the SMS, the discovery of the SMS between Albert Bourla and Ursula von der Leyen for one of the largest contract that we've seen in Europe for several billion doses. As another example, whenever a scientific study was coming about, whether it's on hydroxychloroquine or the vaccine or other subjects, we read those studies, we try and understand those studies, we try to identify whether there are any biases, and whenever we feel is needed, we write a letter of concerns. We have done this many a time. We've done this for the Lancet Gate study. We've done this for recovery. We've done this for the recent study that was published by JAMA on vaccinees versus non-vaccinees that gave superiority to the vaccine because...
This is the study where they, though, wouldn't look at anyone till, like, what was it, 6 weeks or 6 months after injection?
2 weeks. Basically, you have a time window of 2 weeks where the person, in fact, is injected, but is not considered. And then afterwards, you have another period of 6 months where they exclude this. This is bad science.
Terrible. Obvious. I mean, obvious manipulation. Why wouldn't you just show everyone that got the vaccines the moment they get them?
Adele, it's worse than this. It's worse than bad science. Because imagine, it's a French organization called EpiFor, controlled by the state, who goes into the US and publish into a US paper a study. It's a study that could influence American individuals by an agency that's controlled by a foreign state. That could yield massive consequences. Because if an American person reads this study or hear from this study from the media, and it was portrayed in the media, it was used by the media, and the data, the underlying data of this study is not available. JAMA did not have access to this data.
It's amazing.
the scientists who peer-reviewed this did not have access to this data. I consider this could be a breach of trust or foreign interference. And with a group of scientists, including Professor Perronne and Professor Martin Zizi, we wrote a letter of concern. Then we got a response from the authors. We wrote a second letter of concerns. And in the second legal letter, we copied Jay Bhattacharya, we copied Robert Kennedy on this, we copied Senator Johnson, because we believe that this foreign interference will yield some impact on American people. And we believe that a American publication that publish a foreign study, especially when you know that Marco Rubio is negotiating for some peace and we're all looking for interference, foreign interference. We have evidence here that this will yield some consequences. And therefore, that's why we engage. At this point in time, JAMA has our latest letter. They haven't actually come back to us on that one.
So you're doing the same thing we're doing. Go after many lawsuits, trying to find a way and to find a loophole, a weakness.
The message we have been talking about, we try to actually build the informed consent back into people by, first of all, telling them, you can ask questions. You may ask questions, and if you don't ask questions, it's your own responsibility, because the issue is also the responsibility of the people. Right. We've seen vaccine adhesion go down significantly from a 90% high of vaccine adhesion back 5 years ago. Today, you only have 70% who adhere to vaccine. So you have people who question that. And when it comes down to, so that's vaccine adhesion as a whole. And when it comes down to specific vaccination, 55% of people are saying we don't adhere to vaccination in certain instances. Flu, COVID. So we can see that there is a drop in the curve.
There's certainly a drop in the confidence.
However, the next question we've asked the people is, why have you lost confidence? Because I keep on hearing from the mainstream media that it's because of somebody like you or myself. That it's because of alternative media. It's because of conspiracy theories. It's because of anti-vaxxers. And in fact, 60% of people are telling us, no, the social networks and the anti-vaxxers, so-called anti-vaxxers, it's not because of them that we've lost trust. 60% are telling us it's because of the repeated lies of the government. And by the way, they go even further than this. It's high time, 60% say it's high time that the government stop believing their own lies. Right. And what gives me hope is going back from 2020 or 2021, where you had 85% of the French population who got vaccinated. Today, when there's a new vaccination campaign, only 10% will go and get vaccinated. Wow. 90% will not. So that is a first victory. That is, for me, a signal of hope. Public opinion is being curbed. In 2021, we were looked at as being the odd ones. Today, we are probably considered as being the good ones.
Yes. We're making truth sexy again.
Yes. Truth is sexy again.
What a great guy. We actually borrowed his house for some of the interviews. Beautiful home. And he sees the world the way I do. Things are changing. And in France, not only are they opening up to this concept, not only there are more people now waking up and questioning vaccines, some of the best research in the world is being done in France. It actually goes back prior to COVID, during the time where we were really focusing on aluminum and all the work. One of the great scientists there was Romain Girardi, and he has an institute and scientists that have been looking at aluminum. And we got to sit down with one of the newest superstars of that aluminum research. This is Guillemette Crépeaux. I hope I said her name right or somewhere close. But she had some mind-blowing new discoveries in their investigation of aluminum. Take a look at this.
I'm working on aluminum adjuvant toxicity for now 13 years.
Specifically in vaccines, any other products or just vaccines?
Only vaccines.
What is the latest discoveries that you've had on aluminum?
When we studied the cellular responses of immune cells from macrophagic myofascitis patients, and we observed that they respond differently when they are exposed to aluminum adjuvants. They have troubles to produce enough mitochondrial energy to deal with that kind of environmental factor.
This term, myofascic, what was it again?
Macrophagic myofasciitis. It is characterized by a muscular lesion in the deltoid where you received aluminum adjuvants from vaccines, and this muscular lesion is full of aluminum, and it is associated with cognitive impairment and chronic fatigue.
The macrophage, so the immune cells, they go and try to protect us by gobbling up this aluminum that's in the vaccine. And then what happens to the cell once it has the aluminum?
My team has observed a biopersistence for 29 years. Inside the macrophages, it will activate autophagy or inflammatory processes. In the case of this study, we have observed that a specific way of autophagy was involved in these patients, and another kind of autophagic pathway was involved in control. The reaction of the cells are quite different.
So it's changing how they react.
Yes, and probably this explains why they cannot eliminate aluminum adjuvants. And if you have a particle that can biopersist inside a cell, it's a protection for the particle finally. In animals, we have observed translocation of aluminum adjuvants in spleen, in draining lymph nodes, in brain.
And so the cell is essentially holding it, it biopersists, and in essence, the cell is protecting the aluminum so that it can stay, instead of getting rid of it.
Yes, and can just transport them through the lymphatic circulation and go inside the brain.
And now you're saying also that it affects the mitochondria.
We have observed that mitochondria from cells from patients have troubles to increase the production of energy when they are submitted to a very hard challenge for them.
Okay.
If the cells cannot produce enough energy, they won't clear out, they won't digest the particle, so particles will persist more and more.
So it's a cascading effect. It increases. The weaker your mitochondria gets, the more it allows more aluminum to persist.
The repetition of the injection of aluminum adjuvants is a very important point to consider, and we have to remember that the first exposure is during pregnancy. So it's just even before birth. And if you induce a pro-inflammatory challenge to a baby repeatedly, is the exact way to induce a very large increase of microglial activity. If you want to increase microglial cells activity, which are the immune cells of the brain, you have to activate once, twice, third. If they are busy with inflammation, they will have troubles to do their own function, which may be autophagic pathway in order to work on the synaptic density and to induce synaptic pruning and all that kind of well-regulated and very sophisticated mechanisms during brain development. So if you induce an inflammation, they are just trying to resolve that, and they can't do that job.
On almost every vaccine insert, the warning label, one of the side effects is encephalitis, which is inherently brain swelling. Mm-hmm. And you're saying aluminum is increasing microglia production, leading to brain swelling. Do you think this is one of the causes of the encephalopathy we see in the warning label?
Yeah, it must be one of the causes. If you induce a peripheric inflammation, you will induce very persistent change in microglial cells. So you just don't even need to have aluminum into the brain to induce
anything
change.
That causes an inflammatory event in the body of a child can also inflame the brain.
Yes, and this change can last for a long time.
Well, it's a brain damage, is it not?
Yeah, for sure.
That's really, I think, one of the most disturbing interviews I've done. We've done a lot of discussions on aluminum, and you know, they've taken it to a whole other level. So look what she's saying. Anything that causes an inflammatory event in the body can go to the brain. But what they love about aluminum is it's the best it can causing an inflammatory event. It sends the immune system into hyperdrive because it's under such a panic. That's why they use it. And so it's not necessarily just the aluminum qualities, except that it's lighting your body up, causing inflammation, causing the microglia in your brain, which will never act the same way again, as she put it, permanently altered. Similarly, she says we're seeing it affect the mitochondria, shutting down the energy of your cells. Can you imagine doing these two things? Not just to a day one old baby with a hepatitis B shot, but while you're pregnant, you're getting this stuff in shots and vaccines that is going to your developing brain. It stops neural pruning, synaptic pruning. It interferes with that. I mean, oh yeah, by all means, let's stick this into a day one old baby, not just in the Hep B vaccine, but also in the vitamin K shot. And when she was talking about how it shuts down the power of the mitochondria, I couldn't help but remember really the most proven case, because it's the one that paid out in vaccine court, Hannah Poling. Let's revisit what her father said, John Poling, after they pulled his case out of vaccine court. Remember, this case was in the omnibus proceeding. They looked at 6 cases. This one should have triggered that every autism case now gets paid out. Instead, they hid it from the public. Why? Watch this one more time.
We are here with Dr. John Poling. He is, first of all, he's a neurologist. He's also the father of Hannah Poling, as you just mentioned. Her autism, her case of autism diagnosis was conceded by the federal government as having been contributed to by vaccines. That was a pretty startling thing, I think, for a lot of people to hear. We talked to a lot of experts about this. They say, look, vaccines in no way cause autism. You're a neurologist. You're also the father of Hannah. What do you say?
Well, I think you bring up a really important point, is that the government, actually the Department of Health and Human Services, conceded that my daughter's medical problems, which are autism, encephalopathy, seizures, were brought on by vaccination.
That's startling, I think, for a lot of people to hear that, because we've been taught for so long. You're a doctor, I'm a doctor. We go to medical school, we hear this, vaccines, obviously. There's so many good things about vaccines. They prevent, life-threatening illnesses that we've heard about. But in your daughter's case, it turned out to be a problem.
I wouldn't have believed it till it happened to me. To be honest with you, as a doctor, until it happened to me, until I saw the regression, until I saw a normal 18-month-old toddler descend into autism, I wouldn't have believed it was possible.
So what you believe is that did Hannah have some sort of predisposition, and then the vaccines tipped her over the edge into developing autism? What is your belief now?
Well, I don't think that vaccines are the only way that you can tip over a child like Hannah to regress and have an encephalopathy and have regress into autism. There are probably multiple triggers. In my daughter, clearly it was the vaccinations. That was our experience. As far as other families' experiences, it may be different. The other cases that were at Johns Hopkins, there were only a few like Hannah, and then others regressed for other reasons. It's not really a known entity.
So there you have John Poling talking about his daughter had an underlying mitochondrial disorder that made her have a bad reaction to vaccines. And I always thought, well, what caused that mitochondrial disorder? And what we just heard from Guillemette in France is aluminum, that's what it does. It shuts down your mitochondria so it underperforms and it's never the same again. Imagine every baby in America within the first 24 hours of their life of being injected with loads of aluminum. What if we're destroying their mitochondria right out of the gate? And then every subsequent vaccine after that, it's just how good are your mitochondria still holding up? If they're not, that's it. That's it for you. Massive brain swelling event. Your mitochondria didn't have the ability to fight and take the inflammation away, and now you have a brain injury that I think the results can be many different things. Speech delays, autism, Tourette's, probably even ADD, ADHD, in light brain injury issues. But all of that should be being studied. We shouldn't be speculating, but it's obvious where we need to look, especially now with this work being done in France. I want to get to, in sort of finishing up this show, I'm trying to figure out who they is. Well, I actually got some intel on Bill Gates I had never heard before, because Dr. Christian Perronne works with Bill Gates. He works with WHO. He actually helped bring vaccine programs to the entire world. He was really good at talking Africa into getting vaccinated. But look what he discovered along the way. Watch this.
I was approached by WHO. They asked me to chair a big workshop with many countries from Eastern Europe, including Russia and several Russian-speaking republics, about the measles vaccines.
You were sort of in charge of getting all the nations to come together to a WHO agreement on vaccination. Was that agreement to say all of these nations will, mandate vaccines?
Except it was, yes, about to push the measles vaccination.
Measles vaccination specifically.
And they finally, at 12, at the end of the morning, 100% of the countries signed. And I had to manage sometimes meetings with 1,000 representatives of different countries for vaccination. I discovered by Bill Gates and the Gavi Foundation was colonizing WHO year after year, and I could see that from my eyes, and I was upset by it.
Colonizing?
Yes, because the Gavi Foundation, they had representatives at the beginning. They were not present in the European group. They were present in the global group. Meeting in Geneva. The European group, we were meeting in Copenhagen, in Denmark.
Okay.
But we were invited frequently in the global group. At the beginning, there were 2 or 3 Gavi representatives. After years, there were 10. I discovered afterwards that Bill Gates was now is the main sponsor of WHO.
Sure.
And I remember I had a friend, a French guy, very nice physician who was working for WHO. He told me something is a little bit bizarre because he showed me his paper with his salary. And he was paid directly from the Gavi Foundation, the Bill and Melinda Gates Foundation.
So here's this guy working for WHO, but funded by Gavi.
Yes. And I discovered how the Bill Gates organized all his organization and put pressure on all the countries to vaccine more and more and more. And I discovered the concept of Gavi-eligible country.
Gavi-eligible country.
Yeah, you have some poor countries with not many resources for health. They have, for example, 6 or 7 vaccines that are recommended in their official recommendations. And Gavi comes, go to see the Minister of Health, the President or the King, or I don't know, and say, oh, you're a poor country, Bill Gates is a very nice guy, philanthropic. The vaccine costs, for example, $50, but Bill is very nice and he will give you the vaccine for $5. So the minister is very happy. So they add this new vaccine within the national recommendations. But after 2 years, Gavi comes back, oh, Mr. President, Mr. Minister, Bill is very nice guy, but now you have also to pay for these new vaccines. And now it would be, you should do like other countries. Now $5, really, it's not a good price. You should put it to $20, for example. And the minister said, oh, no. But after that, there is a big pressure. And once the vaccine is inside the national recommendations, it's very difficult for a minister to withdraw it. So by this means, they put the pressure everywhere. So if you look on the internet, you can see the list of countries that are Gavi eligible, and some from one day to another become Gavi non-eligible, and they have to pay much more. Like it's a fantastic
So they start as Gavi eligible. They get a discounted price to begin a vaccine program promoted by Gavi. They start that program, and then a couple of years later they come back and say, now that you're in our program, here's the next vaccine, but you're no longer Gavi eligible, you have to pay more.
I remember one day I was in the plane, I was returning to France from this Gavi event, and I was seated in the plane beside one of the collaborators of Bill Gates, and this guy, I was discussing with him, and I said, oh, so you are doing earning a lot of money from the rich countries when you start to market a new vaccine, and as the price is very high in the huge difference between the real cost of fabrication and the cost to the States. You make your return on investment in 1 year or 2 years, and after that, when you propose the vaccine at a much lower price to many so-called poor countries, you win much more money than from the rich countries. And I remember he was smiling and he looked at me. He said, "Oh, I see that you're wise and that you understood our way of functioning."
Wow.
And he told me, "Yes, it's win-win." But I remember very well this conversation, and I realized how all this worked in the world.
Wow.
That's really amazing if you think about it. It made me reflect on Bill Gates in the antitrust lawsuits with the government of the United States he had when it was clear he was creating a monopoly. It's what he's good at, right? He sees the world as, how can I control things? How can I kill my competition? How can I steal an idea, make it my own, and then destroy all of my competition around me? But he got caught red-handed. And so what did he do? Okay, I'm going to move into NGOs. I'm going to be altruistic now. I'm going to be a philanthropist. But look at this business model, right? As a philanthropist, he invests in Gavi and WHO, Bill and Melinda Gates, starts taking control of health systems all over the world, then invests in vaccines. He gets first world countries like America to pay all the cost so that ultimately it's already paid for. Now he's in money-making phase, and he goes to third world countries and said, I'm going to offer you a little deal, suckers him in at $5. It's like a free bag of heroin to a user. Once you're hooked, sorry, now I'm charging you full price. Now what can they do about it? They can't take it off the list. It reminded me of Confessions of an Economic Hitman. Have you ever seen that story where we go in and destroy third world nations by building them infrastructure? He's building health systems, and now they can't get out of it. Now they're paying full price, and he's raking in the money into his nonprofit. Buys jets, buys houses, buys boats, goes all over. Just because it's called a nonprofit, he's still the richest man in the world. And the big question is this, people keep telling me there's someone above Bill Gates. He's just who we see. Maybe that's the case. I'm going to continue my investigation. But I will say this. Did he need someone above him? Let's just say he was smart enough to invest in all world health, which is where his name is. He's got his name in Gavi, he's got his name in Bill and Melinda Gates, and he's got his name in WHO. And as we just heard, if you're working for WHO, you could be getting a check from Bill and Melinda Gates or Gavi. So WHO is his baby. That is his control place. Why does he need someone above him? Did he need someone to give him that idea? Because whoever had that idea, that was the future of world domination. It wasn't banking. Banking will never be able to do. This is outside of banking. This is your body. This is the biggest fear center there is in the world, and he owns it. He's got the masking. He's got the testing. He's got the vaccines. We now just found out that he is in touch with Tony Fouché, and they're writing books together. Well, speaking of Fauci, there was a journalist in France. She thinks it's Fauci. She thinks Fauci is the top guy. She has drawn out one of the most comprehensive book of maps and just linking everybody together you ever seen. Sometime I'll have to show this entire interview. But this is a touch of an incredible life's work investigation she's done on exactly my question. Who is they?
I was on the first channel of the French television, which is TF1, the first one, and I was working as a journalist, reporter, and I made a lot of thousands of reporting on the news of the night, the main news. Okay. I was always on the ground.
Are you still a mainstream news journalist?
No, I left mainstream news in 2018.
Okay. You've been a journalist. You watched this. You've been reporting. Is there a bigger question than who is they and how do they do it?
Yeah, this was exactly the question I had. What we can say is that if we take the chronology, during the Second World War, the Merck laboratory, they made bioweapons for the army, and they founded the first one, Fort Detrick, was founded by Merck
By
Laboratories.
Merck. So Merck founded the first laboratory.
Yes. And with the government, they were working on the bioweapons program because they thought that Germans were doing the same, and they were. And even Japanese were doing the same, and they were. And at the end of the war, MacArthur went to Japan and he took the scientists who made the programs and who had killed a lot of Chinese. And he said, now you don't go to prison, but I take you with me back to the States and you work. You give me all your archives. And that's what he did.
So we brought the experts to pursue germ warfare.
Yeah. There has been a lot of attempts documented by the CIA during the Cold War, by the Soviet Union, and the Soviet scientists were working on bacteria and on anthrax, all the toxins of the bacteria, which are deadly.
Yeah.
Deadly. So they went to the States and they worked for the United States. This was the Cold War. And then after, they went on working on bioweapons. And then it was secret. Of course, it's a secret. And so after, what happened? In 1986, you know, the law about the vaccines.
Liability protection. Yep.
Yes. And after that, you have a law. And then in Twin Towers and the anthrax, you know the anthrax?
Yeah.
It was something arranged to pass a law, which was the Patriot Act. And it's always a threat. And then you have a law
to take more and more of our rights away.
Exactly, your freedom. And then there was a H1N1 2010. And this was the real first pandemic trial, which was a failure for them because the people, they didn't go to vaccinate. They didn't get the jab. They said, no, we don't see the dead.
Right.
And there was no test. So now they made some perfect scenario now. They took the lessons from the H1N1. They saw that you have to have a threat, and if the disease is not terrible, you have to have another lure, a kind of lure, to say this is terrible. And the lure is the false test, because you can say, I'm positive, but positive to what? The trick is to make people believe that they are ill because they are positive.
So what's wild about this is masterminded, it's not like these things are happening in America. They're on a global scale, which means there has to be interconnected.
Yeah.
I mean, essentially with our enemies, right?
Exactly.
I mean,
here you see China.
Yeah.
United States. Here you have
Peter Daszak.
Fouché.
What is sort of the NGOs? You got Tedros, Ghebreyesus, Bill Gates,
Rockefeller,
and the Rockefellers, which are sort of the beginning of modern medicine as we know it.
And here you have the Chinese part.
Okay.
George Gao, the Batwoman, Madame Xi, and another scientist, Mr. Zhang, Professor Zhang. And
when does this relationship start in your mind? Where do they start working together?
We have the proof that Peter Daszak worked with Madame Xi in 2003 with the first SARS-CoV.
Okay.
You know, there was the first SARS-CoV threat in 2003. And this was a pretext to ask for grants to the Congress and then launch the whole thing. And here you have Fauci.
Tony Fauci, you've got him as number one.
Is number one because he's working with the army. He's the head of the army for everything which is bioweapon. And he's dual, so he can have civil work and military work. And he can ask the money, the taxpayer money.
Yeah.
He asks with the White House and with the Congress, and they say, oh, there is a big threat now, give us money. So they give the money and he distributes the money. And he's very, very powerful because he controls everything. Since the AIDS period, for instance, you know. And what did he do? He gave a lot of money to an NGO, which is called EcoHealth Alliance. Yes. So he gave the money to here, Peter Daszak, which is British at the origin. And Peter Daszak gave the money to the Chinese and to Ralph Barrick from North Carolina. And the number one scientist, the number one of gain of function is Ralph Barrick, you know? And Ralph Barrick, at the beginning of 2019, so before the pandemic, in January, he went to China and he made a conference to these people, to the Chinese. What was the title of the conference? How to make a pathogen which is able to create a pandemic. And when the pandemics appear, he says, oh, I don't know. And he didn't say he went to China to teach them how to make false or artificial viruses, which, by the way, is exactly the twin coronavirus of the one that emerged before.
But Fauci's number one. He just doesn't strike me as, he's like a general. He's still working for somebody, something. Is this the super elite money, Bilderberger, Rockefellers, or Rothschilds? Do you think all that plays in?
Of course, yes. Of course, yes. But the names still remain in the dark.
Yeah.
But the structures, they are there. And all here, the investment banks, they own everything. So it's always the same triad.
I think she makes a very important point. It's so sort of where I am. Do the Rothschilds, the Bilderbergs, or whatever you want to call this invisible they, are they out there? She's like, yeah, of course, they're out there. But it really only meant the structure's in place. We see the structure. It doesn't matter if there's someone out there. We've got to face this structure. We've got to destroy this structure that is not bringing any good to this world. And the lead players, we know who they are. They are destroying our future. They are a part of an authoritarian globalist regime that is using health to take over the world. I know that sounds crazy, but we were there. You watched it. We've never watched anything move that swiftly, that quickly, and destroy our sovereignty. And of course, at the top of her list there is Tony Fauci. It's why I think what Rand Paul is doing is so critically important. Is it enough? Is contempt going to lead to something? I mean, look, he's pulling at the only thread he still can have his fingertips on. You had the former representatives of this country and Joe Biden completely pardon the man that's at the top of the structure that sucked the life out of the earth. And Rand Paul is making everything out of that one thread. Maybe. Can he get to Ralph Barrick? Can we figure out what Barrick was doing? Eco Health Alliance. What were they really? How much money really moved? All this. We need answers to all of this stuff. And I'm upset that a party in this country is trying to hide all of those answers. This is bigger than the Kennedy assassination. One person's life was destroyed with that lie. We are talking about millions of people's lives being destroyed. And when we talk about lives being destroyed, we must think about our best and brightest. Those heroes that stood up for us, stood in the truth, the ER doctors that came out in New York with tears running down their face saying, we are killing people in here. This is not what we're supposed to be doing. Louis Fouché is one of those heroes. This man has dedicated his life, risked it all, put it on the line, and had everything taken away. And yet he smiles and he marches on. I'm going to let him have the closing remarks from these interviews in France. Listen to what happened to this guy's life when he simply told the truth.
We created a group, and this group was with nurses, doctors, administrative person of the hospital, and it was just like a something going on. And then we created Rien for COVID, which was a group in charge. And so I became the spokesman of this movement and kind of helping in coordination, because it's one of my talents. As intensive care practitioner, I'm always gathering people, just like an orchestra. Progressively, we built a group in charge to provide science. Another one was with the artist, because we said we're not going to understand this crisis with the head. It's not in the head. And maybe we could try and understand with the heart. And so the artists in France, they were said by our president to be non-essential.
Right.
Yeah, you remember that?
Yeah.
Yeah. And so I said, no, art is essential in this very moment. We need people to tell story. We need people to write plays. We need people to make movies about what was all going on. And we also realized at the same time that on YouTube, LinkedIn, Facebook, everything was censored. Each time, even with humor, we were trying to deal with what's happening. Censor, censor, censor. There were a YouTube channel which had, in 1 month, it's like 150,000 people following, you know, really fast. So we started gathering the people everywhere, small groups everywhere in France, all around France, 250 groups in France, but also in Australia, in Israel, in Germany, in Spain, in England, in Canada. We became a multinational company with no bank account, with no administrative structure. We were even an NGO. Yeah. We understood that we shouldn't be alone, because one head, you can cut it. But when you have 100 heads, more difficult. We had a lot of doctors everywhere in France, and so we said, but we can care for the people at home, where we had a nurse, a doctor, a oxygen provider, and we gave protocols with C vitamin, D vitamin, ivermectin, anti-clotting medication, oxygen at home.
You're building an underground network.
Yeah, right.
Saying we're not following the protocol. I'm going to go save lives whether you like it or not.
And it was working well. We cared for like 25,000 persons, and none of them went dying. And very few to the hospital.
People.
Yeah. And that, I think that was maybe one of the most beautiful things that we've done. I called my wife and said, okay, maybe I'm going to lose my job.
You had that sense, or you thought this is...
And I felt, the gut feeling was, the fear was there.
Yeah.
And I went there, and there was 200 persons in front of the building saying, go on, Louis, go on. Wow. There were guards. But those guards, they were the guards of the hospital, and I know all of them. And so they smiled to me and clenched with their eyes and said, we're with you, Louis. Go on.
Yeah.
And there was the TV, the national TV there, you know, with the microphone saying, are you going to be fired? Dr. Fouché, are you going to be fired?
Wow.
And they said, we've been quite surprised, because we thought you were a crazy, insulated person, but we received more than 10,000 emails on our email boxes, and it jammed our boxes, each one a mail, saying, take care of Dr. Fouché, is important, his speech is needed. And after they had deleted the first 10,000 emails, other 10,000 coming, and it never stopped.
Wow.
And so they were surprised. I started to understand it was not my force, it was the force of the community, force of the people. I was the knight entering the dragon's cave, but the knight was armed by the community and the people of the village. And after that, nothing happened. So this happened like that the first time. But in France, the healthcare providers who refused vaccination, they were supposed to be suspended.
So that's where it all went down, when you refused to vaccinate? That was the final straw? So
But
they weren't firing you?
No.
They're just suspending you?
It's a pervert thing, you know, it's a perverted thing.
And if you quit, you don't get paid?
No. And
you couldn't get them to fire you. If you would vaccinate, you could have your job back.
Yeah.
So you're just suspended until you vaccinate.
Yeah, intimidation, pressure, coercion. But we decided with my wife to say no. It was not an easy decision. I mean, I don't judge.
You have children at this time?
Yeah, I had 3 children.
3 children.
A house to pay.
A house to pay.
Yeah. And
no pay coming in.
No, nothing. And then you have kind of a choice there, where a face choice. It's just like Moses going through the Red Sea, you know. It has to open. But you don't know if it's going to happen. So you need to have the water till there and wait for the miracle.
Yeah.
But the miracle happened. I mean, when the decision has been made, everything contributed to help me keeping on. I had time to organize resistance and network of resistance because I didn't work anymore.
Yeah.
The suspension lasted 606 days.
Wow.
This is a long time.
I think most people would say I couldn't survive that. We wouldn't survive.
Another person, he was coming every week, he is a friend, to have lunch with me. And each time he brought meat, but each time he brought too much. And I told him the first time, oh, this is really too much for us. Well, get that back to your home. And I said, no, keep on, put it in the fridge, I don't care.
He kept bringing too much food to the lunch.
He was giving me food for my kids.
Just keep it.
Yeah, it was nourishing us. In my street, it's a neighborhood of doctors. And so all the other doctors in the street, we know each other. And they knew what I thought about the COVID. And they disagreed because they were in the propaganda.
Yeah.
But each week there was a small basket with croissant there, hung on my door for my children. And I know who he is, who does that every week. He never put his name, never said who he was, but I know, I'm sure who he is. And he disagreed with me about COVID. But he thought that suspension was such a bad thing, he couldn't agree that, and he wanted to help the way he could. When I made that choice to lose everything, actually I had luck. I had more than what I needed.
Luck, yeah.
There's something deeply rotten in the kingdom of France and medicine, and it's a long time. And I only saw that. I saw that during the COVID, but it was there. And some people saw that 10 years ago, some other 20 years ago. The industrial way of things is about replacing the artisanal work by industry. It's about trying to have a perfection instead of having something artisanal. If we want perfection, what's the mistake? The mistake is always the human being. And we should maybe get rid of the human being if we want perfection. It happened during Nazism. It happened all the time.
Nazism,
and transhumanism is about getting rid of the human mistake. And it is just the same in our medicine now. If we want to get rid of the virus, if we want to get rid, each time you hear this, eradicate, fight against, all those words are related to war and to destruction. But this is not about life. How can we shift in that system collapsing? How we can get back our sovereignty and autonomy? And that's really inspiring because you can see that in all the breaches that are opened by this collapsing system, the people are doing things. We have a guy named La Fontaine, and he wrote a story about the dog and the wolf. And the dog is very big, is eating well, and everything's fine. It's comfortable. And the wolf is like that, he has no hair anymore, he's running all the time, and never know what tomorrow is going to bring. And the wolf gets to the dog, and the dog says, you just have to come with me. Come, and the master is going to give you something to eat. You're going to be well. Come with me. And the wolf says, well, that should be good. Maybe I should go. But in a moment, he sees that there's something on the neck of the dog and says, what's that you wear on your neck? And so the dog says, oh, that's my collar. That's how my master keep the hand on me. And then the wolf disappears. And it's still running. That's the end of the story. Wow. It's still running. So now I think I'm the wolf. Not comfortable, but freedom has no price. And I must say that I don't regret anything. In French, we have two different words for hope. One word for hope is espoir, and espoir means you're waiting for something to happen which is not in your hand. There's going to be a savior, there's going to be a messiah, there's going to be somebody coming and free you. This one I don't trust. I don't believe in it. No, I'm not waiting for anything. Nobody's going to come.
Yeah.
We are the one.
Yeah.
When you're not alone, you can change the world. The only thing is, you give the energy. You put the first flame.
Sure. Spark.
The first spark. Yeah. You light the spark, and the barrel was. And you change the world.
Well, if there's one thing I'm realizing as I tour the world, it's that we really are all in this together. And when you're supporting the work at ICANN, I've said we are all about strategy. And part of my strategy is to make sure that we are not the last front standing, that we're not the only battleground here in the United States of America. We can't win if the entire world is against us, especially when we know all it takes is one presidential election. Really, that's all that's left. There is this very thin little veil that we have. And I'm not saying Trump's the greatest president of all times. I'm not saying you have to vote Republican. But I will say, imagine if we get anyone in office that tried to bury the Fauci story, that doesn't believe it's important to investigate what happened during the pandemic and why did we get lied to? What were lies? What were the truth? What did we invest in? Did we fund gain of function? Anyone that is telling you that has no relevance, to me, it's the most relevant story in human history. Not just in my lifetime, which a lot of us say, oh, this is the craziest thing that's happened in my lifetime. This is the craziest thing that ever happened in the world. Name one other thing where every nation of the world used the same exact set of lies and infrastructure, as Corinne put it, all against the citizens of the world. And now we know, whether accidental, whether knowingly, they were dead wrong. As Christian Perronne put it, what didn't they get wrong? Was there anything they got right? Of course, every government wants to bury this. Of course, every doctor involved in it wants to bury it. Of course, every news agency that were propagandists for it wanted to go away and never be seen again. And if we allow that to happen, guess what? It won't take much of a memory, because we'll only have to remember it when we're back in it. There's a reason I'm traveling the world. We are lighting the fires of truth everywhere they can be lit. We are trying to support Vincent in France. We have Aaron Siri working with their attorneys. I was just sitting in England. Can we raise funds in England? Wherever you are in the world, we need to all work together now. We are the Informed Consent Action Network, and this network is worldwide. And together, we are going to fight an authoritarian takeover that is trying to be established through this word health. Your health is in your hands. And if it's in anyone else's, you better be very afraid. We're in this together. We are a family worldwide. We're all waking up to the same realizations. And we are winning. I'll see you next week on The High Wire.